Have you ever had that sudden, heart-stopping moment when you realize you forgot to take your birth control pill? It's a common experience, and the panic that follows is completely understandable. But before you start worrying too much, take a deep breath. Missing a pill doesn't automatically mean your birth control has failed, but what you do next is very important. The right steps depend on what kind of pill you're taking and how many you've missed. Let's break it down together so you know exactly what to do. First, it's crucial to know there are two main types of birth control pills: the combination pill and the progestin-only pill, often called the mini pill. The combination pill is more common and contains two hormones, estrogen and progestin. The mini pill, on the other hand, contains only progestin. Because they work differently, the rules for what to do when you miss one are also different. Let's start with the most common one, the combination pill. If you've missed just one pill, or you're less than 48 hours late from your last scheduled dose, the solution is usually simple. Just take the missed pill as soon as you remember, even if it means taking 2 pills on the same day. Then continue taking the rest of your pack as you normally would, 1 pill each day. In this situation, your protection against pregnancy is generally not reduced. According to medical guidelines, you typically do not need to use a backup method of contraception, like condoms. However, what if you've missed 2 or more pills in a row? This is where things get a bit more serious, as your risk of pregnancy increases. If you've missed 2 or more consecutive active pills, you should take the most recent pill you missed as soon as you can. Discard any other missed pills from the previous days to avoid confusion. Then continue taking the rest of your pack as scheduled. But here's the key difference. You need to use a backup method of birth control, like condoms, for the next 7 days. A surprising fact is that the timing of when you missed the pills in your cycle matters. If you missed pills during the last week of your active pills, week 3, for most 28-day packs, your plan changes slightly. In this case, you should finish the active pills in your current pack, but then skip the placebo or sugar pill week entirely. Instead of taking the inactive pills, you should immediately start a new pack of birth control pills. This helps keep your hormone levels stable and maintains your protection. It does mean you will likely miss your period for that month, which is perfectly safe and normal in this situation. Now let's talk about the progestin-only pill, or the mini pill. The mini pill is much more time-sensitive than the combination pill. This is because the progestin in the mini pill has a shorter effect in your body. For most mini pills, you need to take them within the same 3-hour window every single day to be effective. If you are more than 3 hours late taking your mini pill, you should consider it a missed pill. Take the missed pill as soon as you remember, and then continue with your regular schedule. However, you must use a backup method of contraception for the next 48 hours or 2 full days. It's a shorter window than the combination pill, but it's just as important to follow. No matter which pill you take, if you've had unprotected sex after missing pills, you might want to consider emergency contraception. It's most effective when taken as soon as possible after the event. It's always a good idea to talk to a pharmacist or doctor to determine if emergency contraception is the right choice for you and which type would be best. A good habit to build is setting a daily alarm on your phone to remind you to take your pill. Tying the habit to another daily activity, like brushing your teeth or having your morning beverage, can also make it easier to remember. Remember, this information is a general guide. Your specific brand of birth control might have slightly different instructions, so always check the patient information leaflet that comes with your pill pack. Being prepared and knowing what to do can turn a moment of panic into a manageable situation. You have the power to stay in control of your reproductive health. For more clear and reliable information on sexual health, don't forget to subscribe to Sex Education Repo.